Hi everybody, it's Dr. Hulka. You give me a few minutes. I'm going to add some groups to this live. So in any event, just so we get started and give a few minutes to everybody to sign on, I haven't done a live in a long time. I've been doing my 2 to 3 minute videos and posting them on pretty much all of my social media. But mostly through medically related through the Essure groups. My Essure website, noessure.com, as well as all of the Essure subcategories of the Facebook pages. But the reason that I wanted to go live today was to incorporate this message to all of the foreign body groups that we talk about. We're talking about the breast implants. We're talking about Filschie clips, Essure, of course, Hulka clips, and as well as the meshes. And today in particular, I wanted to talk about the gallbladder clips because I've come across a lot of patients that are in the gallbladder group that feel an exceptional amount of frustration that they're not able to find any doctors that are willing to help them out with the gallbladder. So that's what I wanted to do today, is talk about why I feel and why a lot of my colleagues feel that these foreign bodies should be removed and why we're doing it, and also to try to network. And again, we're only starting from the beginning, network for those that are actually want these particular devices removed and how to go about doing that. So today's comments or today's message has to do with gallbladder clips and also a little follow-up on Essure. They're equally important, so I just wanted to give a couple stories and to share with you the couple stories. Number one, Jackie, who is a Facebook friend through Essure, asked me to clarify a couple things related to Essure. And first of all, although I do remove Essure, I just want you to understand that there are a lot of other great doctors. Dr. Tassone out of Austin, Texas, Dr. Steve McCarris out of California, that are removing Essure, and these are true experts in the removal of Essure. So if you can't communicate with us, I can see about referring you on the East Coast and further into Austin, Texas, related to Essure and its removal. What I wanted to say related to gallbladder, and this is coming from Linda, who got in touch with me today, all the way from Canada. So for anybody out there in Canada, hello everybody, and this is for Linda to comment for her is yes, I was able to network with my colleagues that are colon rectal surgeons here in El Paso, Texas, related to the removal of the gallbladder clips. Now, back to Essure for a moment. I'm going to jump back and forth, but basically for everything. I'm also going to have a separate comment for everybody that's had breast implants placed. If you're not aware, the FDA has required that all doctors that are putting breast implants go through a patient checklist. Now, I've been talking about patient checklists since even before Essure, and if you were even before the commentary, the narration of The Bleeding Edge, which I narrated and commented on in that particular medical documentary. But we're talking about the informed consent and patient checklist. If you have breast implants or want to get breast implants now, the FDA is requiring to sign on with a patient checklist. And so that is the same type of concept that we were talking about with Essure, with the patient checklist. And once a patient checklist was added as a requirement from the FDA, sales of Essure dropped dramatically. And we understand why, because if you really understood what you were doing when you were having Essure placed in your body, you would have never have had that placed. And what's frustrating is the issues related to other surgical clips. Most patients that have had surgery may not know that they have a surgical clip in their body. Surgical clips, although made out of titanium and nickel, do degrade over time, and they're not a perfect titanium product. They're a titanium alloy. And so patients that get surgical clips placed, you may not even know that your surgery was done with surgical clips. And sometimes there's a foreign body reaction under the autoinflammatory autoimmune syndrome induced by adjuvants, or the Asia effect, which causes a foreign body reaction, and you may have subtle symptoms that you're not even aware of. You're losing your hair, skin sensitivity, you're losing your teeth. you're gaining a significant amount of weight, you're having pain in the particular area where you had surgery. All of these are related to a foreign body reaction. In the case of surgical clips, they're generally associated with the area of where you had your gallbladder removed. If we're talking about Essure, it's generally in the area where the Essure devices are. If we're talking about Filschie clips and Hulka clips, the same concept applies in that particular area. If we're talking about mesh, we're talking about mesh in that particular area, abdominal mesh, hernia meshes, inguinal meshes, and of course, unfortunately for women that have had stress incontinence, urethral meshes, transvaginal tape, and the vaginal meshes and the rectal peritoneal meshes. So all of these fall under the potential complications of the foreign body reaction as far as the Asia effect. And in many cases, patients suffer for years without even knowing that they have a problem. In the case of breast implants, you understand that you get a capsular contracture and may need to have the implants removed. Or if you're suffering from breast implant illness, that's what probably you're noticing is an Asia effect with your implants. If we're talking about surgical clips on a gallbladder removal, you may notice that you're having issues with digestion, your issues with chronic pain in the area where your clips are. And things like that. So the bottom line is today's message, or that today's conversation, was that I wanted to just address the fact that yes, there are doctors that can remove these devices, that are willing to talk to you. Here in El Paso, one of my fantastic colleagues, a great friend of mine, Dr. Jaime Gomez, is a colon rectal surgeon that is willing to discuss the removal of gallbladder clips. In the case of Essure, of course, I remove them, or Dr. Tassone in Austin, Texas, Dr. McCarris in Celebrations, Florida. And the meshes, we could also speak about removing meshes with Dr. Gomez if you're interested in removal of a mesh. So I wanted to address those particular issues. So let's talk about gaslighting. And again, I hope to be able to share this with all of the groups that are going to be watching. And I apologize if I'm not really that good on adding groups to this discussion. Let's see if there we go. So give me a moment, and I'm going to try to add to these groups. If I can add, I'm not sure if I can. With my wife was here. She always helps me out, but she's taking care of the baby. Seem to have forgotten how to do. Oh yeah, there we go, with share. So let's try share. Some people not appear. We do the privacy. Okay. I don't think that I have this on private. I thought this is public. Okay. Anyway, I'm having some trouble with that. So let's talk about gaslighting. When you go to your doctor and you tell them that you have a problem, many times that doctor will say, well, first of all, either they may be supportive or they may be dismissive, and you usually know just from the beginning of the conversation. In the case of both Essure and also, I have to just generalize it in general, but in the case of Essure and the case of gallbladder clips, gaslighting is pretty common. You're going to go to a doctor who says that either your Essure, the complaints that you have are not associated with Essure, or completely dismiss it altogether, or refuse to refer you to someone. What I mean by gaslighting is that your Essure, you have an Essure complaint, and then the doctor, you mention us, the doctor, myself, you mentioned Tassone, you mentioned McCarris, and your doctor says, okay, well, I'll get in touch with these doctors. Let me tell you, they don't get in touch with us. Okay, they're not. I post. I have so many Facebook pages and friends on Facebook pages and the websites that we at least have a track record of somebody trying to get in touch with us, and they're not. Perfect example is today. Linda from the gallbladder group got in touch with me, and I was able to communicate with her for over 30 minutes and just listen to what her complaints and her story. And quite frankly, hers is not the only story of the similar issues with gallbladder clips. When people get in touch with me through my email addresses for Essure, it's the same story. Is that first of all, the insult of having had something placed without without the patient knowing exactly what they had placed in their body, or the potential complications of that particular device having been placed in their body. Second of all, it's the doctor's denying that that particular implant is causing any problems to the patient. Third of all, the doctor refusing to do anything about it when the patient asks that they be removed. And fourth of all, the doctor claiming that they are in touch with other doctors to get more information about whether or not it's a valid concern or valid interest in trying to remove these devices. So the particular issue with Linda, who's from out of Canada, she got in touch with me, and I just made a simple phone call, and I was able to get in touch with my colleague, Dr. Jaime Gomez, who said, sure, I'll be glad to see your patient for the removal of a gallbladder surgical clip. There you go. So how hard was that? There are doctors willing to remove surgical clips, and it only took one phone call for me to be able to answer that question. When it comes to Essure and the removal of Essure, I don't remember the last time that I told a patient that there wasn't an indication or a reason why she couldn't have her Essure removed. Most of the time when a patient is getting or seeking a second opinion, if she has any general type of GYN pain, GYN pain is enough to merit the consideration of removal of the tubes or doing a hysterectomy. So when you're waiting weeks, months, or years to get help, I just can't answer that particular question as to why it's so difficult. Only the individual patient with their individual doctor can address that particular issue. But I'm telling you that there's so many of us that are willing to help, and so many of us open-minded enough to wanting to help. And there you go. And so that's what I wanted to address. If you're being told by your doctor that they're trying to get in touch with us and can get in touch with us, I would have to say that that's a stretch of the imagination, to say the least. Now, I can't say that I personally can answer every single question, but again, I post letters on my website of noessure.com. There are letters to colleagues there that you can download. Of course, there are the videos that I'm creating for that. As far as the gallbladder, the meshes, and everything else, I post on those particular groups, including, for example, Filschie clips. I can remove Filschie clips, and I remove them all the time. Hulka clips, remove Hulka clips all the time. And so, and we do notice that when you remove the implants, patients get better. Now, you don't see that in 100% of cases, but I would have to say between 80 and 90% of patients that have a foreign body, either a breast implant, a Filschie clip, a Hulka clip, surgical clips from the gallbladder, the meshes, once they're removed, patients start to feel better. Again, I'm not saying that every patient suffers a foreign body reaction, but for those that do, the removal of the foreign body tends to make them feel better. And these issues with foreign body reactions are lifelong. They tend to get even worse over time, and so we have to keep that in mind, that if a patient is suffering with a foreign body reaction, that they should get it removed as soon as they can. Under normal circumstances, they should. So that's what I wanted to address today, that we still are, there are doctors that are available to help you. We can try to coordinate a little bit better. Again, I can't answer every question, but there are colleagues of mine that are in, for example, in the Essure group, there's a list of doctors that you can go to for Essure removal. And if you're having a delay in treatment, like first of all, for example, Essure, if a patient comes to me for an Essure removal or a consideration of an Essure removal, the initial appointment is followed up by lab work, EKG, chest X-ray, pelvic ultrasound, CT scan. We're all getting that done within days. And once I have those results back, then we discuss whether or not surgical removal is a viable option. In the case of, I tend to, and Dr. McCarris, for example, tends to recommend the removal of the fallopian tubes and the uterus together. Why? Because we know that if you leave even a tiny bit of the coil or the PET fibers in the fallopian tubes or in the uterus, the entire spectrum of foreign body reaction can still occur or still be present in that particular patient. So, and you have to core out the abnormal tissue, the scar tissue around the fallopian tube, for it to be a valid surgery. And a lot of doctors are simply removing the tubes and leaving the uterus behind, but they're leaving all that scar tissue, all of those fragments of the PET fibers, fragments of the Essure coil behind. So And in the cases of fallopian tube removal only, that we're either making sure that the entire coil is in the fallopian tube, or making sure that we core out the abnormal tissue associated with that Essure in the uterus to preserve the uterus. Now, Dr. Tassone, for example, is an expert in that particular technique, and I will refer patients that are not willing to have their uteruses removed to Dr. Tassone. Now, I prefer to consider that once you have Essure, you have something similar to a cancer effect. It's a completely contaminated area. Therefore, I remove the tubes and I remove the uterus in an attempt to be definitive in the management, because in cases where you don't remove the uterus, patients still suffer from foreign body reactions and therefore definitive or abnormal bleeding and all of the other issues related to post-tubal ligation syndrome. So I tend to go with the removal of the uterus. Now, as far as surgical clips are concerned, there are doctors that are willing to do that. Like I said, Dr. Gomez, for example. So there shouldn't be a delay in that. So when I have gotten all of that paperwork back and we review it, I go over that information with my patients, and then what I say is okay, well, you do qualify. You have some type of pelvic issue. You have some pelvic problem. You do qualify for the removal of the Essure coil, and we're planning surgery within just a few weeks, not months or years, which some of my colleagues some patients are being postponed, and even the evaluation of an Essure removal, we're talking about years. Some patients spend years trying to get ready for an Essure removal, and we're talking about with the network that we're talking about of doctors, that can be narrowed down to a number of weeks. I wouldn't say days, but a number of weeks. So the message I'm trying to address is very, very clear. Don't let your doctor gaslight you into thinking that you don't have an issue when obviously you believe that you do. There are doctors that are very, very open-minded, especially since we do know as doctors that the devices that we placed in the human body can cause an allergic or hypersensitive reaction or foreign body reaction. And my colleagues may not know that that is actually umbrellaed under the concept of Asia effect, but it's there. And so if you're hitting a brick wall when it comes to at least being open-minded, obviously I would suggest that you get a second opinion. But in many cases we're so ingrained in believing in our doctors, and I thank my patients for believing in me, but we're so want to believe that our doctors are there to help us that sometimes they don't realize that maybe their doctor is a little bit too close-minded and they're not really getting the care that they should, which they should try to talk to someone else who is a little bit more open-minded. And if you're getting a delay in how you're being managed, maybe you should get a second opinion. In any event, I hope that answers, or post a comment for a live for today, that I really, really appreciate everybody watching. And please, this is a public forum, so I have no problem, and I hope that people will share my videos publicly, or share the links to them to everyone in all of the groups, the breast implant groups, the gallbladder groups, the Filschie clips, Hulka clips, the post-tubal ligation groups, the Essure groups, the mesh groups, and just try to coordinate that what I'm trying to say when I speak on a particular subject really falls under that Asia effect, or the umbrella effect of it. And many times when I'm talking about an issue such as brain fog, I have brain, I cognitively I'm not remembering things like I used to. I notice that I'm kind of spacey sometimes, quote unquote spacey sometimes. Many people can describe that as brain fog. And that can be associated with your Essure, for example. Or you gain an excessive amount of weight, that might be associated with your Essure, or even your breast implants, for example. So things like that are exceptionally important to consider, that you speak to your doctor. And again, that's the purpose of doing these Facebook Lives, is to share this information and be supportive of all of the hundreds of thousands of men and women that are unfortunately suffering from foreign body reactions, that unfortunately we as your doctors are actually part of the problem. So again, thanks so much for watching. Please share these videos to everybody that's interested in each of the groups. And again, Happy New Year. Thanks so much for watching. Take care.